Welcome to this explainer, designed specifically for all of you exhausted parents out there. Listen, if you're tuning into this, you are probably navigating that incredibly daunting transition out of the newborn phase, just desperately trying to find a path to safe, restorative sleep for your whole family. Well, today, we're going to rely on actual clinical research and proven methods to cut right through the noise, and we'll figure it out together. Our agenda today is super focused. We're going to cover exactly 5 things. Number 1, the sleep training decision. 2, what the research actually says. 3, popular sleep training methods. 4, the chair method explained. And finally, number 5, the AAP Safe Sleep Guidelines.
All right, section 1, the sleep training decision. Let's talk about when and why to even start.
Surviving the 4th trimester often leaves parents completely overwhelmed and, frankly, chronically sleep deprived. So when is it actually time to start training? Experts typically recommend aiming for the 4 to 6 month mark. Developmentally speaking, this is the sweet spot. By 4 months, most babies are physically capable of sleeping for 6 solid hours between night feeds. And by 6 months, they are generally ready to sleep through the entire night. Neurologically, they are finally equipped to learn how to self-soothe. Now, when you're weighing this decision, there's a very real balance you have to consider. The benefits are amazing, right? Teaching your baby to self-soothe leads to consolidated, much better sleep for the baby and for you, which dramatically lowers the stress levels in your house. But, it is not a magic wand. The cons are real. It takes absolute, total commitment from all caregivers. It almost always involves some crying. And let's be honest, it can be a really emotionally stressful few nights for you as a parent while your baby adjusts to this new routine. Moving right along to section 2, what the research says. This is where we put data up against internet myths. Probably the biggest barrier for parents is this intense guilt and fear that sleep training might somehow hurt their baby. It leads to that terrifying question haunting all our late-night internet searches. Is letting your baby cry going to permanently damage your parent-child attachment? And hey, that is a completely valid, deeply protective concern to have. But longitudinal research provides a really clear, reassuring answer here. A landmark 2012 Australian study that followed kids for 5 whole years found absolutely 0 differences in attachment security or behavioral problems between sleep-trained and non-sleep-trained kids. None. Furthermore, when clinical studies monitor acute stress hormones like cortisol, they show that while stress does elevate a bit on night 1, it returns to a completely normal baseline within a single week. Your attachment is built on your overall, consistent daytime responsiveness, not on whether you teach them independent sleep at night. In fact, randomized controlled trials show these training methods are incredibly effective. Get this. Up to 90% of infants treated with extinction methods show significant improvements in sleep consolidation, plus a drastic reduction in night wakings. The bottom line? It works, and it works safely.
Let's jump into section 3, popular sleep training methods. It's all about finding the right fit for your family.
So there is no single best method out there. The real secret is matching the approach to your baby's unique temperament. Take full extinction, for example, which you probably know as cried out. This involves putting your baby down awake and not returning until morning, unless there's a safety concern, of course. Research shows this actually works the fastest, often in just 3 to 4 nights. On the other hand, you have graduated extinction, better known as the Ferber method, which uses predetermined, slowly increasing check-in intervals to offer brief comfort. So how does that look in practice? Well, on night 1 of the Ferber method, you don't just close the door and walk away. You wait 3 minutes, go in and verbally soothe them, then you wait 5 minutes, soothe again, and then stretch it to 7 minutes. This structure really helps your baby learn to self-soothe without ever feeling totally abandoned. And for adaptable or persistent babies, this structure is a total game changer. However, some highly sensitive babies actually just get way more distressed by those brief little Ferber check-ins. If that's your baby, gentler methods definitely exist. There's fading, where you gradually decrease the time you spend rocking them to sleep, or the pick-up put-down method. You just have to keep in mind that the data shows these responsive alternatives take significantly longer to actually show results. They require immense physical and emotional patience from you. All right, section 4, the chair method explained. This is a great gradual approach.
If you're looking for a middle ground approach, something that offers security while still actively encouraging independent sleep, the chair method is fantastic. Some people call it the sit-back method. Essentially, you stay close by in the room, sitting in a chair, and you provide very minimal verbal reassurance. Think just a simple, "I love you, it's time to sleep." You do this while your baby does the active work of falling asleep. It is literally the ultimate exercise in gradually fading out your support. The process takes about 10 days, and it builds progressively. You start right beside the crib for nights 1 through 3. By nights 4 to 6, you slide that chair to the middle of the room. Nights 7 to 9, you're shifting over to the doorway. And by night 10, you are out of the room completely. You are slowly teaching them independence by literally creating physical distance over time. So who is this actually for? Well, this method is ideal for babies over 6 months old who really benefit from that visual reassurance of just seeing you in the room. It's also perfect for parents who have a low tolerance for crying and find the idea of full extinction way too overwhelming. The catch? You have to be able to stick to this structured, gradual 10-day plan without backsliding. Okay, bringing us to our final part, Section 5, the AAP Safe Sleep Guidelines. These are the updated rules for 2022. Now that we know how to help our babies fall asleep, we absolutely have to talk about where they sleep. Look, if you are completely exhausted at 2 a.m. holding a crying baby and you're just overwhelmed by all the conflicting advice out there, I want you to remember 3 non-negotiable words for your baby's sleep space: flat, clear, and separate. That is the gold standard for infant safety. Let's break down how that applies practically. Your sleep surface has to be a safety-approved crib or bassinet that is entirely flat and firm. When it comes to location, you want to share a room for those first 6 months, but never, ever share a bed, couch, or armchair. Those are incredibly dangerous if you accidentally fall asleep. And for bedding, you use a fitted sheet and a wearable blanket. That's it. The EEP strictly advises you to avoid inclined sleepers, loose blankets, and there should be absolutely 0 weighted swaddles or weighted sleepwear in that crib. And speaking of those inclined sleepers, the magic number to remember here is 10. Federal safety rules under the Safe Sleep for Babies Act now mandate that infant sleep products have an incline of 10 degrees or less. Why? Because anything steeper than that significantly raises the risk of airway obstruction or the baby rebreathing exhaled gases. And yes, this rule applies even if your baby suffers from reflux. Backsleeping on a totally flat surface is still, without a doubt, the medically recommended safer choice. Now, a huge part of safe sleep is also just knowing when to actually worry. Frequent night wakings, wanting to be soothed, and making those light grunting sleep noises, that is completely normal baby behavior. But red flags require immediate 911 emergency intervention. If your baby has labored breathing, blue or gray lips, if they feel unusually limp, or if they are just incredibly hard to wake up, do not wait around. Call for help. I also want to touch on technology, because so many parents today buy these high-tech smart monitors hoping for peace of mind. While they can give you some general awareness of what's going on, both the FDA and the AAP explicitly warn that no home monitor is authorized to prevent SIDS. You literally cannot rely on a gadget to replace your adult supervision and a fundamentally safe, flat, and clear sleep environment. We've covered a ton of ground in this explainer today. As you navigate all of this at home, I really want you to ask yourself, are you prioritizing consistency and safety over the pressure of perfection? Because at the end of the day, sleep training is just about finding a sustainable, safe rhythm that works for your unique family. It is definitely not about achieving some flawless, totally unrealistic internet standard. So give yourself some grace. Trust the decades of clinical research that proves sleep training is safe. Know that teaching your baby independent, secure sleep is honestly one of the most loving gifts you can possibly give them and yourself, because a rested family is a healthier, happier family. So armed with all this knowledge, what is your first step toward a restorative night's